In this article by Sunil Roger and Kendon O'Hara, it talks about a study done to determine how technology can aid one affected by cystic fibrosis in their daily life. Cystic fibrosis is a genetic condition that makes it difficult to clear mucus from the lungs, thereby leading to frequent infections, long-term lung damage, and ultimately a reduced lifespan. This condition is common amongst Northern Europeans and affects over 10,000 people in the UK. Because this condition is chronic, care is long-term and patients have to visit treatment centers regularly. This all becomes a cycle of patient self-care and clinical care. They all become an interdependent system in order to keep the patient's health in check. The paper presents the idea about how technology can help facilitate patient self-care and provide vital information about their health at home for doctors to analyze during the visits. However, barriers to making such advances are finding ways to understand the patients that the potential system is trying to help, and how clinics can accommodate and collaborate to improve treatment alongside the technology.
In this study, a grounded theory approach was used. This means that data was being obtained and analyzed in an ongoing, iterative manner. It was furthermore acknowledged that there was a subjectivity to this method, and theories generated from it could not be applied universally. The study is a qualitative study that consisted of observations with semi-structured interviews with 8 patients and 10 multidisciplinary teams. 10 consultations were observed between members of multidisciplinary teams, and the CF patients and observational notes were written down. In the 18 interviews, it was audio recorded and open-ended questions, which was used to gain an insight into how the technologies might be used to change CF care, as well as the overall experience of the current way to treat CF, both from the patients and the multidisciplinary team's point of view.
The results section discusses how it's difficult for patients with cystic fibrosis to maintain the habits to keep their cystic fibrosis at bay. Everyday life, from work to taking care of their families, comes in the way because over time, doing physio and taking medications twice a day isn't necessarily enough. For some patients, technology has been extremely helpful in maintaining a routine to both track and monitor their behaviors. Most frequently used seems to be activity trackers such as Fitbits. These technologies are helpful because patients don't have to set aside time to write down what they ate for a meal or ensure they're getting enough exercise. Instead, their phones and activity trackers track this for them. Another problem that causes a low adherence to treatment plans is a patient's desire to disassociate from their cystic fibrosis. However, this need to distance themselves causes them to not stick to their treatment plan or reach out for mental health help when necessary. In some cases, forums have been helpful to encourage and inspire patients with cystic fibrosis to achieve their goals. However, patients can't always help themselves from comparing themselves to those on these forums. It's also discussed how cystic fibrosis clinics are also not ideal for most patients because they aren't hospitable and they disrupt a patient's daily life. Furthermore, because clinics have to address the risk of cross-infection, scheduling is not as flexible as a normal physician's office. An ideal situation could be the use of home-based self-care because it allows patients to be more involved with their bodies. They themselves can track triggers and how their body reacts to certain treatments, rather than depending on physicians who only see a snapshot of their experience. Through the discussion with patients, it seems as though if home-based monitoring could influence the care provided by the multidisciplinary teams, it would make the patients feel more understood. Furthermore, MDTs could get a holistic view of the patient's experience. Additionally, creating a way for professionals to determine whether a patient needs to come into the clinic beforehand could also save time and increase flexibility for the patient. Lastly, the discussions mention that a remote clinic would be beneficial for the patients because it would increase flexibility as well. Overall, patients seem to want the system to be updated to cater to their specific needs. Instead of disrupting their daily lives to go to a clinic when it's not necessary, they'd rather a system that works for them and lets them live their life to the best of their ability. Through the use of technology and self-monitoring, patients could regain their self-efficacy and motivation to monitor their cystic fibrosis and take care of their bodies as necessary.
There is an interest of understanding how personal monitoring technologies and applications might facilitate key aspects of the cycle to achieve better health outcomes, such as cystic fibrosis and other chronic conditions. Such technologies could adopt many forms, from supporting patient self-management to enabling better remote monitoring by a clinician, and many configurations in between. From a patient's perspective, the study highlighted several important considerations when considering technology, which might affect future reconfigurations of cystic fibrosis care provision. First, there's already a significant burden of care for cystic fibrosis patients in terms of the daily medication. Physiotherapy and dietary monitoring that must be juggled in the context of other everyday responsibilities. This study highlights the value trade-off which must be considered when designing technologies for collaboration in chronic health conditions such as cystic fibrosis. These cannot be assumed to be generic across all or even very similar conditions. Rather, we have to look at specific aspects of the condition result in particular healthcare structures and how technologies might facilitate their recognition.
Hi, I'm Tiffany, and I'll be talking about telehealth and its impact on the health industry. Proponents of telehealth are envisioning a new age in healthcare that centers around remote patient care and monitoring. Telehealth is being pushed as an effort to expand access to convenient care, address talent gaps and shortages, better monitor and treat at-risk populations, among many reasons mentioned in the article written by Mike Billiard. A big obstacle to telehealth is not so much provider adoption as demonstrated in the statistics, but rather the patient's willingness to use it. Of course, telehealth isn't here to replace traditional face-to-face healthcare, but provide an alternative method. For example, I've engaged in a phone checkup with a doctor, which is a lot more convenient, but this was only the case because my condition was low risk and easy to diagnose. And not all cases are like that and may require in-person care and interactions. Telehealth lacks the connection you have when interacting with your patient or provider in person. Unlike face-to-face visits, it might be difficult to build that same rapport virtually. Still, telehealth will be an effective tool for things like monitoring. In-person checkups don't offer as comprehensive a view of a person's condition as monitoring does, as kind of shown in the previous articles that we read, such as with the shrinky dinks, which can ultimately be done remotely. Still, I think it's important to consider when telehealth can be most advantageous, as it may not be effective in certain scenarios as face-to-face interactions can.